Welcome to the Maternity Mentor. Today we will be talking about yeast infections in your breast, how to treat them, and the best tips to avoid them altogether. Stay with us. Hi, I'm Samantha. I'm a board-certified nurse practitioner and I have over 12 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Breast yeast infections are unfortunately very painful and very common. It's important to recognize the signs of this infection quickly because it can spread to other family members, including your baby if left untreated. Let's explore what causes breast yeast infections and how to treat them. Thrush is another name for a yeast infection. We commonly hear the term thrush used when a baby gets a yeast infection in the mouth, whereas a yeast infection in the breast is just called a yeast infection. Both are caused by an overgrowth of the fungus Candida albicans. Candida is normally found on our bodies, but it can start to overgrow in warm, moist, dark environments like skin folds and even mouths. Bacteria that are normally found on your body help keep the fungus in check, preventing overgrowth. When we take antibiotics, it kills off some of those natural bacteria on our body, upsetting the balance between fungus and bacteria, allowing the fungus to grow out of control and develop into a yeast infection. Breastfeeding women can experience an overgrowth of Candida on the breasts, leading to a breast yeast infection, or their baby can develop thrush in the mouth and transfer the infection to the mother's breasts. There are some risk factors that have been identified that places a mother at higher risk for developing a yeast infection of the breast. These risk factors include having diabetes, leaking breast milk excessively combined with the use of breast pads, having a yeast infection in another part of the body like the vagina, a family member with a yeast infection including the baby having a yeast diaper rash, taking birth control pills, using antibiotics or corticosteroids, bottle use in the first 2 weeks after birth, using a pacifier, anemia, and previous nipple damage that has started healing. It's important to know not only the signs of thrush in yourself, but also your baby. Signs to look out for in yourself include shiny skin on the nipple and/or areola, flaking skin on the nipple and/or areola, small bumps, blisters, or white patches around the nipples, burning nipple pain, severe stabbing pain in the nipples, itching sensation in the nipples, pain in the breast without sore lumps or tender spots, loss of color in the nipple or areola, swelling of the nipples and areolas, and sharp stabbing pains deep in the breast. Symptoms of thrush in your baby include white patches inside the mouth, on the gums, inside the cheeks, and on the tongue. These patches look like milk left over on the tongue. If you try to wipe these patches off, it will leave red sore areas that bleed. Your baby's mouth will probably be sore and uncomfortable, which can make the baby fussy. Your baby may slip on and off the breast while breastfeeding due to this pain, and you may even hear a clicking sound while feeding. Your baby may also develop a diaper rash on the bottom, which is red and bumpy. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about the treatment of your breast yeast infection. Once you have been diagnosed with a yeast infection in the breast, it's essential to get treatment. As the name suggests, yeast is an infection and usually needs a medication to be prescribed and taken for the infection to resolve. Your provider may prescribe nystatin cream to be applied directly to your breasts and nipples. This antifungal medication can be very effective at treating the yeast infection. If this is not effective, or if the provider feels you need a more systemic or body-wide medication, they may prescribe diflucan. Diflucan, also called fluconazole, is a pill you take by mouth. For a vaginal yeast infection, diflucan usually is prescribed for approximately 3 days. For a breast yeast infection, diflucan should be taken longer, for 2 weeks, in order to be effective. Diflucan is safe to use while breastfeeding. Finally, your healthcare provider will treat any other yeast infections you may have to prevent the spread or reinfection of yeast. This may include Monistat or other vaginal creams or suppositories that you can find over the counter in your local pharmacy. As always, take the medication exactly as prescribed and don't stop just because you feel better. If you stop early, the yeast infection may return and be harder to treat, requiring even more medication, some of which may not be allowed when breastfeeding. If you have a yeast infection in your breast, it is essential to get your baby treated at the same time, even if baby is not showing obvious signs of infection yet. Yeast infections can be a vicious cycle between mom and baby, where it gets passed back and forth because they are not both treated at the same time. To prevent this, make sure to call your pediatrician immediately if you are diagnosed with a breast yeast infection and request treatment for the baby. The treatment is safe and will not harm your baby. For an oral yeast infection, your pediatrician will probably prescribe nystatin oral suspension. This is a medication that is usually brushed on the inside of your baby's mouth, and it should not interfere with breastfeeding. Another common oral treatment that may be recommended by your pediatrician is gentian violet. Found usually in specialty pharmacies, this is a natural substance that you paint all over the inside of your baby's mouth to treat thrush. Gentian violet should not be used for more than 7 days, and you should be aware that it will stain your baby's mouth purple for a week or so. Baby drool may come out purple and stain clothes, and you may also find that your nipples and areolas are stained purple. Finally, babies can also get fungal diaper rashes. If your pediatrician suspects this, they will prescribe a diaper rash ointment or cream like myostatin or Lotrimin to treat it. If you suspect your baby has thrush, contact your pediatrician first. Never treat it on your own, and always follow your pediatrician's advice. Along with medications, there are other important treatment tips you need to follow to get rid of yeast fast and prevent it from coming back. First, stop pumping and storing breast milk. The medications you are taking will treat the yeast infection. However, the pumped milk can contain yeast, and the yeast can continue to live even in the freezer. Weeks or months later, when you go to use that breast milk, you and the baby can redevelop a yeast infection from it. While being treated, stick to direct breastfeeding or pumping milk to use only for the current feeding. Next, make sure to wash your hands often because yeast infections easily spread from person to person through touch. Wash your hands every time you use the bathroom, every time you touch your breasts, and every time you change your baby's diaper. Additionally, gently wipe off your baby's hands after you breastfeed to prevent your baby from spreading the yeast infection. You should wash your nipples and breasts at least once a day and let them air dry for 20 minutes. Direct sunlight on your nipples for a few minutes every day can be very helpful. Some women choose to use a vinegar wash, which is 1 part vinegar and 4 parts water, when cleaning their breasts, because yeast cannot survive in acidic conditions. If you have been diagnosed with a yeast breast infection, make sure you wash your sheets, bras, pajamas, shirts, breast pads, and towels regularly, because these items can all cause reinfection. During treatment, everyone in the house should be using their own towels, including hand towels, which should also be washed regularly. Replace any items like toothbrushes or cosmetics that may have come in contact with yeast. And finally, make sure you're sterilizing any items that are coming in contact with your breast or your baby's mouth, including pump pieces, nipple shields, pacifiers, sippy cups, teethers, toys, and bottles. Sterilization kills the yeast and prevents these items from causing reinfection in either you or your baby. The best treatment of breast yeast infections is prevention. There are so many things you can do to avoid getting a breast yeast infection to begin with. For starters, wear only cotton nursing bras because cotton is a breathable fabric that will allow for air circulation and helps keep the nipples drier than other materials. Change your bra and wash it every day to keep it very clean. If you are using reusable breast pads, they should be changed several times per day and washed regularly. If you are using disposable breast pads, they should be removed and discarded several times per day. Keeping a wet bra or nursing pad against your nipple for long periods of time allows for yeast to grow. Next, ask your healthcare provider about starting probiotics. Probiotics can be used to help keep your microbiome in balance by providing you with good bacteria that can keep the yeast from growing out of control. Finally, sugar is a yeast's best friend and helps it grow big and strong, so limiting sugar in your diet may also help the infection heal faster, and it definitely won't hurt you. Yeast infections can be frustrating to deal with. I hope this has explained what causes breast yeast infections and how to treat them. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.